Greetings, everyone. Welcome. Welcome to the first virtual workshop of the Harvard Global Nursing Leadership Program. Good morning, good afternoon, good evening. I am thrilled that you've chosen to join us today for the Harvard Global Nursing Leadership Program. It is a program that is a collaborative initiative with the African Union, the Africa Center for Disease Control and Prevention, and the World Bank. The program is jointly governed by the Harvard T.H. Chan School of Public Health, the Harvard Kennedy School of Government, and the Harvard Graduate School of Education. The program is designed to help support the development of nursing and midwifery leaders needed to play essential roles in major global health initiatives, including the Sustainable Development Goals, the Global Health Security Agenda, the Universal Health Coverage Initiative, and so many more massive global health initiatives that are important to the livelihood and to the opportunity for allowing populations everywhere to thrive. This program will offer a powerful new certificate degree opportunity, as well as an MPH degree when we are fully established. And these two programs, the certificate program and the MPH degree program, will give ministry level nurses and midwives the foundational fundamental training, both didactic in classroom and experiential in the field, opportunities to acquire the skills, the techniques, to harness new technologies, new methodologies, leadership and management skills, so that global public health practices and approaches can be brought into every space where public health approaches are needed. Although we'll start our training focusing on African nursing leaders, where the needs are currently the greatest, we intend that the program will rapidly expand to include nurses and midwives from Asia, Latin America, the Caribbean, and North America. We have purposefully scheduled this workshop today to coincide with the World Immunization Week for 2021. This is a week where the World Health Organization, the Harvard Chan School, and many other institutions engaged in global public health have highlighted the urgent need for a renewed global commitment to improve vaccination diplomacy, to improve our equitable access and uptake of vaccines, and to make clear that we together have to use the tools of global public health to serve everyone everywhere. This theme of our inaugural keynote this morning and today is about vaccine equity and the role nurses and midwifery leaders can play in securing the successful design and implementation of vaccination programs. We are thrilled that more than 85 participants from 20 countries are joining us today. Our audience includes more than 60 national nurse and midwifery leaders, holding titles such as Chief Nursing Officers, Chief Midwifery Officers, Chief Nurse Regulators, Deans of universities and colleges, and directors of trade unions and other health organizations. I'd like to just take a moment here to thank the faculty involved, the staff, all of us who are enabling our gathering today to support the program. Before I introduce our inaugural keynote speaker, I also want to thank our sponsors, the Burdett Trust for Nursing and the Gordon and Betty Moore Foundation. I also want to thank all those at the Africa CDC, the Africa Union, and those at the World Bank Group, as well as colleagues at Harvard for their wonderful collaborative spirit and engagement. Now, I have to say it is a genuinely great pleasure and honor to present our inaugural keynote speaker, Dr. Ngozi Okonjo-Iweala, Director General of the World Trade Organization. Dr. Ngozi is a global finance expert, an economist, and an international development expert with more than 30 years of experience working in Asia, Africa, Europe, Latin America, and North America. She has had a 25-year career at the World Bank as a development economist, and she has served twice as Nigeria's finance minister and also as Minister of Foreign Affairs. She has served as chair of the board for Gavi, the Vaccine Alliance, and in 2020 was appointed as African Union Special Envoy to mobilize international financial support to fight against COVID-19. There are many more details about Dr. Ngozi's incredibly impressive career in the program. But I do want to just take another minute and say that she has been and continues to be an important member of the Harvard family with many years of service, and that she also holds multiple degrees from Harvard and MIT. In 2020, Dr. Ngozi was appointed the Angelopoulos Global Public Health Leader at the Harvard Kennedy School, and she serves on the President's Global Health Council. Dr. Ngozi is an elected member of the American Academy of Arts and Sciences, and her list of honors and awards and honorary degrees, and I count 7 to date, are too many to list. But I do want to call out 2 of them. The first one that I'd want to call out is the honorary degree from the Northern Caribbean University in Jamaica, my home country of birth. And I'm so proud that my countrymen and women recognized you, Dr. Ngozi. And then I also want to acknowledge that you are the recipient of Nigeria's Commander of the Federal Republic. And these are just 2 of the many well-deserved awards. So if you can't tell from that introduction, it is really truly a privilege and an honor to welcome Dr. Ngozi. Dr. Ngozi, over to you, and thank you.
Thank you so much, Michelle. Thank you, Dean Williams, for that. You know, I always joke that when I hear about myself, I can't believe it's me. It seems difficult to take in, but thank you. Thank you, distinguished guests who have tuned in from around the world. It's an honor to be here today as the keynote speaker at the Harvard Global Nursing Leadership Program's first virtual workshop. Thank you for selecting me, and congratulations on the successful launch of this vitally important initiative, which is designed to strengthen nursing and midwifery leadership capacity in Africa and around the world. So happy to see your focus on nursing, one of the most noble professions in the world. Everyone knows that, though I'm a hardcore finance and economics professional, but I have a particularly soft spot for health because I've seen that a sound health policy is the bedrock of a sound and sustainable economic policy. This pandemic has cemented this belief. So to all of you who have collaborated to create this unique program and had the foresight to begin in Africa where the need is greatest, thank you so much. Increasing the leadership capabilities of Africa's nurses and midwives to effectively respond to disease threats and outbreaks will strengthen the continent's public health infrastructure and ensure the provision of quality healthcare. But before I begin my remarks, I would like to recognize 2 of my favorite African brothers and my sister who have been instrumental in the Harvard Global Nursing Leadership Program's creation and implementation. Dr. John Nkengason, Director of the African Centers for Disease Control and Prevention, and Dr. Mohamed Ali Pate, Global Director, Health, Nutrition, and Population Global Practice at the World Bank, and also the Director of Global Financing Facility for Women, Children, and Adolescents, the GFF. I want to recognize Professor Sheila Tlu, former parliamentarian and Minister of Health in Botswana, who is also Regional Director of the Joint United Nations Program, UNAIDS on HIV/AIDS, and currently co-chair of the Global HIV Prevention Coalition and the Nursing Now Global Campaign, funded by the Burdett Trust that Dean Williams mentioned at the beginning. So thank you, to these wonderful colleagues and friends and brothers and sisters. It is intentional and significant that we're holding this virtual workshop during World Immunization Week. Immunization saves millions of lives every year, and I saw that firsthand from my perch in Gavi. And immunizations, vaccinations are widely recognized as one of the world's most successful public health interventions. Yet, there are still nearly 20 million children who are not getting the vaccines they need. And with the COVID-19 pandemic, we have to not only ensure equity in securing vaccines for distribution to more than 6 billion people in the world, but we must also address the myriad of factors that promote and sustain vaccine hesitancy. I'm here today to speak about the issue of global vaccine equity and the opportunity for nurses and nursing leaders to play a substantially increased role in vaccine administration and advocacy. As the Director General of the World Trade Organization, and in my work as chair of Gavi and one of the founders of COVAX, I have had a front row seat to the issues surrounding world vaccine access and distribution. Vaccine equity is not just a moral imperative. It is a strategic and economic imperative. Yet from the moment the COVID-19 outbreak began, countries have resisted or flat out refused opportunities to work together. Supply constraints, protectionism, and nationalism plagued the early months of the pandemic. They continue to characterize the market for the emerging crop of vaccines. States acting in their own perceived self-interest are in fact acting in no one's interests. The consequences will come back to haunt all of us. If wealthy countries vaccinate their populations, while poor countries with limited access to vaccines are left out, the cost to the global economy will exceed 9 trillion, according to some studies, with wealthy countries bearing more than 40% of these losses. Economic stagnation will continue with worldwide repercussions. Time is of the essence. We must recognize that the multilateral trading system is fundamental to fighting the COVID-19 pandemic. Protectionist behavior and trade barriers affect supply chains and create an uneven playing field, with the potential to reduce vaccine production at a time when increased supplies are critical. If we don't change course now, some parts of the developing world may not see substantial vaccine shipments until the end of 2022. That's not acceptable. Solving these access problems require cooperation and coordination. International organizations must work together to achieve rapid rollout. There is a related problem, and that is getting vaccines into arms as quickly, efficiently, and equitably as possible. This is where there are ample opportunities for nurses to step up and fill the gap. Throughout history, nurses have played a crucial role in advocating for and in delivering vaccines. Many countries are actively working to expand that role. In a recent International Council of Nurses survey, the majority of countries reported they were increasing and actively cultivating nurse immunization role engagement. In many nations, advanced practice registered nurses and registered nurses are well prepared to carry out key immunization interventions, such as raising awareness, communicating effectively to drive out fear and hesitancy, education, vaccine administration, prescribing, and policy development. In particular, in many nations now, vaccine prescribing is a role for nurses. Based on the survey results, the ICN recommends that countries should focus on reinforcing and expanding nurses' contributions by increasing immunization education, as well as program and policy development. Several African nations, such as Kenya, Namibia, Botswana, Uganda, and South Africa, have legislation that expands the scope of practice of nurses to prescribe. Other African countries are following suit, even without such specific legislation. We have Cameroon, Zimbabwe, Rwanda, Swaziland, Eswatini, Malawi, Tanzania, Zambia, Ghana, Lesotho, and Ethiopia. For reference, among the nations that have the legal framework for nurses to prescribe are Australia, Canada, New Zealand, Ireland, Sweden, UK, and the USA. The bottom line is that we need to advocate for the expansion of the scope of practice for nurses and midwives to meet the needs of our world's populations now and after the pandemic. I commend the World Health Organization and its campaign on the Year of the Nurse and Midwife 2020. The campaign is still going on. Also, I commend WHO for the 2020 State of the World's Nursing Report, which presents a compelling case for considerable, yet feasible, increased investments in nursing education, jobs, and leadership. Again, it boils down to a concerted effort to work in partnership for the greater good. I'd like to close with my favorite saying in my mother tongue, Igbo, so bear with me because I always quote this. Roughly translated, it means if the right hand washes the left hand and the left hand washes the right hand, then both become clean. It is only by working together, by one hand washing the other, that we can chart a way through out of this global crisis and thrive in the future. Once again, I thank you all and I wish you the very best for this session. Thank you for inviting me. It's a privilege. And Michelle, I applaud you. Thank you.
Thank you so much, Dr. Ngozi. Thank you for your dynamic and inspirational presentation. What a great way to start off our workshop. You have set the stage for our panel discussion, where we will continue to consider the recommendations for ways forward to ensure vaccine equity and to enhance and support nursing leaders in their role of the vaccination campaign. Thank you again for taking time out of your incredibly busy schedule to join us. And please know that we all wish you well.
Thank you. Thank you. Thank you.
Thank you so much. Now, please, all of you, join me as we pivot to our next agenda item on our workshop, and that is our panel discussion, where we will have several renowned colleagues, friends, and anchor partners join us for a conversation. I would like to turn this part of the program over to Dr. Stephanie Ferguson, co-director of the Harvard Global Nursing Leadership Program. And Dr. Ferguson, who many of you know, has been with the Harvard Chan School for a year now. And I like to say that she is the secret sauce in the program's development and operations. I appreciate all of the work that she does, the exquisite leadership skills that she brings to this program. And I also am grateful for the way she helps us continue to work with our anchor partners, our key stakeholders. Welcome, Stephanie. Over to you.
Thank you, Michelle. I just want to thank you. And what a boost we have gotten today, a shot in the arm from Dr. Ngozi. And so I'd like to also to say thank you to Michelle again, because it's Michelle's vision and her leadership where she has taken this forward to champion the development and strengthen the leadership capacity of nurses and midwives around the world in the context of public health. And so we really appreciate you, Michelle. Without further ado, I want to introduce you all to Sheila Talou. Dr. Sheila Talou, to many of you, you know her. She was a former parliamentarian and also Minister of Health of Botswana. She was the director of UNAIDS Regional Support Team for Eastern and Southern Africa for many years, from 2010 to 2017. And she's also a renowned researcher. And one of the things I want to say that some of you might not know about Sheila, Sheila received from the International Council of Nurses the Christine Ryman Award. That is the equivalent of the Nobel Peace Prize for nursing in our world for all of her international and global work. So I think, this is one thing I want to highlight about you, Sheila, that most people don't know about you. And we also just want to let everybody know, Sheila is the co-chair of the Nursing Now Global Campaign with the Burdett Trust for Nursing. And she is also the co-chair of Global HIV Prevention Coalition. So I'm going to turn the panel program over to Sheila, who's going to be our moderator. And you will see me come back and help her with the questions when we open up the question and answer session. So as you're listening to the panelists, please use the Q&A and let us know your questions. And we're going to try to take as many as we can in the time frame. Thank you and welcome, Professor Sheila Ndlovu.
Great. Thank you very much for your kind introduction, Stephanie, and a warm welcome to everyone who has joined us for this auspicious event, the virtual workshop of the Harvard Global Nursing Leadership Program. Now, let me thank you, my dear sister, Dr. Ngozi Okonjo-Iweala, for a fantastic and very inspiring speech. She has already left, but she set the stage and recommendations for us to reflect on and to further discuss strategies and solutions for ensuring vaccine equity during pandemics, and of course, the important role of nurses in vaccination programs. It is a great honor for me to be part of the Harvard Global Nursing Leadership Program, to serve on on the program's board of directors, and to be your moderator for today, for this panel. Now, as you may be aware, the Harvard Global Nursing Leadership Program is modeled on the tremendously successful Harvard Ministerial Leadership Program. I had the great privilege of participating in that groundbreaking initiative as a minister, as well as the Botswana Harvard AIDS Institute partnership. As co-chair of the Nursing Now Global Campaign, I wish to now talk about the voice of nursing, the power of nursing, and how we can harness that power to advance and support vaccine equity. Nurses are a force for universal health coverage. And that is why it's so important to make sure that we empower them with the education, the training, and everything that they need to lift and lead the health of nations. In my work as co-chair, I see firsthand the many ways in which nurses are key to getting people vaccinated. They lead the campaigns, they teach, they educate, and they drive out miseducation, misinformation, as well as stigma and discrimination. As former Minister of Health of Botswana, I know what it takes to tackle epidemics because I led the country's successful response to HIV and AIDS. As is the case with COVID-19, HIV spread very quickly. And for Botswana with a small population, the social and economic impact was actually very devastating. We, however, responded swiftly and forcefully with measures to effectively manage the epidemic. Nurses were at the forefront, just as they are today with COVID-19. Primary health care and public health were key, just as they are now. And working with families and communities made a difference then, and it will still make that difference now to turn the corner of this pandemic. Without equity in vaccine distribution and deployment, however, this will be a challenge to achieve, especially in Africa. We must deliver vaccines the same way as we deliver basic healthcare services, based on rights, inclusiveness, universality, and ensuring that no one is left behind. Let me simply say that it's not enough to say to nurses, you are responsible, you must lead this effort. It is not enough. We must equip them with the knowledge and skills to be effective leaders, to be leaders who can inspire and motivate, to be leaders who can communicate the importance of that activism to persuade everyone to pull together towards a common goal. And that's what forms the basis of why we're here today. Now, with that, let me turn over to my esteemed colleagues to further our conversation on today's topic. I would like to introduce you to Dean Michelle Williams, who just spoke before, Dr. John Nkengasong, Dr. Mohammed Ali Pate, and Ms. Shirley Banks. I'll introduce all of them so that then when they speak, they share ideas like in unison. So I'll start with Michelle Williams. She is the Dean of Faculty at the Harvard T. Chan School of Public Health. Now, Dean Williams is an internationally renowned epidemiologist and public health scientist, an award-winning educator, and a widely recognized academic leader. She is my sister. And prior to becoming dean, she was professor and chair of the Department of Epidemiology at the Harvard T. Chan School of Public Health and program leader of the Population Health and Health Disparities Research Programs at Harvard's Clinical and Translational Sciences Center. Her background includes a distinguished career as professor of epidemiology at the University of Washington School of Public Health, co-director of the Center for Perinatal Studies at the Swedish Medical Center in Seattle, and an affiliate investigator of the Fred Hutchinson Cancer Research Center in Seattle. At the University of Washington, she developed and directed the Reproductive, Pediatric, and Perinatal Training Program. Her scientific work focuses on reproductive, perinatal, pediatric, and molecular epidemiology. She directed a multidisciplinary international research training program that prepares undergraduate and graduate students in global health, biostatistics, and epidemiology in South America, Southeast Asia, Africa, and Eastern Europe. Now, that's just in a nutshell. Let me now go to my brother, Dr. John Nkosazana, who is the Director, Africa Centers for Disease Control and Prevention. He was appointed the first director of Africa CDC in 2016 to provide strategic direction and position as an African-owned institution supporting countries to improve surveillance, preparedness, response, and prevention of disease threats. He's a leading virologist with 30 years of work experience in public health. Prior to his appointment with Africa CDC, he was Associate Director of Laboratory Science and Chief of the International Laboratory Branch of the Division of Global HIV/AIDS Center for Global Health at the US CDC. Earlier in his career, Dr. Nkosazana worked for the WHO as Chief of Virology at the Collaboration Center on HIV Diagnostics at the Department of Microbiology, Institute of Tropical Medicine, Antwerp, and later joined United States CDC in 1995 as Chief of Virology Laboratory in Abidjan, Cote d'Ivoire. Now to my other brother, Dr. Mohamed Ali Patey. He is the Global Director, Health, Nutrition, and Population, Global Practice of the World Bank, and Director of the Global Financing Facility for Women, Children, and Adolescents based in Washington, DC. He is right now in Nigeria, though. Dr. Patey was until recently Chief Executive Officer of Big Win Philanthropy based in the UK, and prior to that, he held several senior positions, including that of Minister of State for Health in Nigeria. He was previously in the World Bank Group, where he joined as a young professional in 2000 and worked on health issues in Africa, East Asia, and the Pacific. Last but not least, my dear sister Shirley Benz, that I've been with for more than 10 years now. She is the Chief Executive, the Bede Trust for Nessie. She has more than 30 years of experience in corporate, private, and charitable trust work. She began her career at Touche Ross and PwC, and subsequently moved to Pemberton Greenwich to manage the finances of the John Lyons charity. Over the years, she has managed the finances of discretionary, charitable, and life interest trusts. She began working for the Bede Trust in 2003, becoming its chief executive in 2008. During this time, she has been responsible for developing its strategic policies, managing its financial systems, procedures, and budgetary control, grant giving, accounting, and risk mapping. And she has really been a great asset to nursing now, to nursing globally. Ms. Benz has also served as a trustee of Grantscape and Treasure Charitable Trust, both of which are UK grant making Charitable Trust, the woman after my own heart, because she holds the purse. Now, let me start with Dean Williams, and then I'll go on to John, then Mohammed, and then to Shay. Thank you very much. Over to you, Dean Williams.
Thank you, Sheila. I really appreciate this opportunity to kick off the conversation, and I will be brief. I just want to say that, as Dr. Ngozi clearly highlighted, we have to ensure equity in securing vaccines for distribution to more than 6 billion people in this world. And we also have to address the issues around vaccine hesitancy. We won't really close the gap and really address the challenges that this pandemic is threatened all of us if we don't address in a very aggressive and authoritative way these risks. And nursing leaders are at the epicenter of executing on this massive pandemic scale challenge. One of the things that this COVID-19 lesson has taught us is that we do need nursing. We actually need more nursing leaders and more nurses right now if we want to effectively control this outbreak. Prior to COVID, we knew that we were going to be short nearly 6 million nurses worldwide by 2030, with 4.7 million nurses expecting to retire by 2030. So the bottom line is, and this comes from the WHO State of Nursing report, we have to invest in capacity building. We must invest in nursing education. We must create a stronger, more robust workforce that has the resilience and the capacity, as well as the leadership skill to manage these threats on scale. The pandemic has taken its toll on nursing and midwifery professionals, and we will have to stem the loss of caregivers across health systems, nationally, regionally, and globally. The central role that nurses play in our population health management work, our vaccination programs outside of the pandemic, our control of non-communicable diseases, our management of health surveillance systems and reporting of reportable infectious disease, all requires us to ensure that nursing leaders, nurses, midwifery leaders have the skills, the capacity to integrate new technology, to have the financial awareness and capacity to manage their duties in the most proficient and capable way. So I'm delighted that we're having this conversation. I'm delighted that we're engaging in speaking with nursing leaders to hear from them how a curriculum for nursing leadership and management should be developed so that they can manage not only the COVID-19 pandemic, but other crises and challenges of population and global health. I'll turn over back to you, Dr. Sheila.
Thank you very much. She has said that we have to invest in capacity building. So I'm going over then to you, handing over to you, John.
Thank you, Sheila. And it's tough to go after Dr. Ngozi and Dr. Dean Williams because they've literally said everything that I thought I would be able to say. When I heard Dr. Ngozi speak, I adjusted my talking points, and then the few remaining points that I adjusted, Dean Williams covered them. So let me just now speak very freely. I think they took off the burden of a structured discussion. Yeah, but first of all, really thank Dean Williams for from the conception of this idea, the Global Nurse Leadership Program, to the execution and implementation. I happened to be in she had actually invited me to give a talk at Harvard last March, when we were watching as a continent what was going on in the world with respect to the COVID-19 outbreak. At that time, it was still an outbreak, not a pandemic. And it was, and I was at Harvard giving the talk half-heartedly because my half of me was back in Africa and thinking of how do we prepare ourselves against this. And again, during that same week, Mohammed will recall we were having series of calls the weekend thinking about the World Bank was mobilizing billions of dollars to, and Mohammed was calling me and say, how do we do this? I mean, it was a very challenging period for all of us. We saw the threat coming and we're trying to scramble to kind of fight the enemy there. And I remember in the restaurant one of the evenings that Michelle was kind enough to offer us dinner, thought about this idea and said, she had this idea, and I thought it resonated. I thought it was wonderful. Each time we think of a public health workforce, we're always thinking of the epidemiologists and lab experts. And so it was just like that. It clicked with me and left it at that. And I thought it was another idea that would probably may or may not have legs, but it took off. And I think today, it's really an honor to have been able to partner with you all to get this done with Stephanie and some of my colleagues from the CDC, Africa CDC. Dr. Tajuddin is on this call. I believe Dr. Faith and others have been working really faithfully and dedicatedly to making this happen. I think it's truly an honor for the African Union and Africa CDC to be part of this. Unfortunately, Dr. Ngozi has left, but I wanted to appreciate her for how much she has impacted the continent in a way and manner in which we have responded to this pandemic. As a special envoy, I think I've learned some very basic banking things that maybe Mohammed will continue to be my educator there. When we were forced to work together by President Ramaphosa, as in her role as envoy, Donna Kaburuka and others, all kinds of things that I've never, you were out there, special drawing rights, and when they use those words, they say SDR, or immediately turn off the camera and Google to find out what is it that they are saying. Then I show back up and acted like I knew what they were saying and all the kind of things there. But it is what a pandemic does. I think I use that as a segue to say that we should not waste this pandemic and bring forward a whole cadre of healthcare workforce that has been, in my view, not fully exploited. And I think we should also learn from the other pandemics. I think that would be my second message. The only two messages that I want to deliver here: not wasting this pandemic and learning from other pandemics. So the first, with respect to not wasting this, I think that the role of the critical role of nurses here has been highlighted. But let me just say that, put that in an equation that we promote all the time at the Africa CDC. We say vaccines plus vaccination equals life save and economy save. So, and it's very clear that if you look at the vaccination part of it, the backbone of that is really the nursing. How do we have a competent nursing workforce that exercise leadership and can actually carry the burden of the vaccination program forward in the spirit of demand creation, in the spirit of building trust? And there's so much that hinges around trust here. The whole underpinning of public health itself is trust. And vaccines, we are dealing. We find ourselves at a very unprecedented time that building trust with the community and creating demand at the community level will actually be critical for our ability to vaccinate at speed and vaccinate at scale to win this battle against the COVID-19. And I think the nurses, the leadership role of nurses is also very important to address inequities. The inequities should be really defined broadly. And inequities is not just having a north-south divide with respect to access to vaccines, but it's actually within the same country and within the same communities. I think those inequities must be addressed. And it should also, of course, must include the critical role of nursing, the central role that they play in this. I think we all know, and Dr. Ngozi mentioned this, that health is wealth. And if we do this and do it right, I think put the nurses at the center of that, then we are very directly, and I'm sure that Mohammed will touch on this, and we are very directly creating work by having a healthy population, especially in the developing part of the world. Let me just, before I go to my second point and last point, which is borrowing from the past, is that we have to look at equity from what I'll characterize as the most urgent issue of our time. The most urgent issue of our time as a young continent that is only about 60 years old is the COVID-19, how to win the battle, the war against COVID-19. Those who founded Africa, the independence, or guided Africa towards independence, the Jomo Kenyattas, the Julius Nyereres, the Kwame Nkrumahs, and the rest, fought their issue at that time during the creation of the African the Organization of Unity of Africa, OAU, was freeing the continent from independence. I don't know of anything that has threatened the continent after they fought that battle to liberate the continent as COVID-19, the threat that COVID-19 poses to our continent. And I think that is clearly a battle of survival that requires that we mobilize the frontline troops, and the frontline troops that we need to mobilize here are really the nursing across the board to incentivize and advocate for vaccination uptake on the continent. And that is a nice segue for me to conclude my remarks by discussing the issue of borrowing from past pandemics. Sheila has been a champion, a hero in the fight against HIV/AIDS. The continent of Africa happens to be fighting two pandemics. HIV/AIDS is a pandemic and it's not gone away. And now the COVID-19. I mean, we have to ask ourselves the question, how did we apply ourselves as a continent when we were threatened, and really threatened at a level of complete annihilation when HIV/AIDS was all over? Countries like Botswana, Sheila's country, and others saw life expectancy drop dramatically before the era of antiretroviral therapy became a reality and brought back life expectancy to where it is today, and then also beat back the rate of new infections on the continent. What do we do? I mean, if you look at the history, and I hope that when the history of HIV/AIDS will be written on the continent, that the central role of nurses, what they did in administering antiretroviral treatment will be captured properly and adequately in the textbooks of medicine and the history of HIV/AIDS in Africa. We have to learn the lessons from that. It is only until when we did task shifted for treatment, when ARV started with, it was very clear. People said, no, Africans they don't know how to read the Times, so they would not be able to administer. Then, only doctors can administer that. Then we kind of got real with ourselves and said, no, we have to liberalize this and do task shifting. And nurses started playing a critical role. Then we scale up ARVs. So I think this is a time for us to think of the lessons and borrow some lessons from HIV/AIDS and what it became a game changer on our continent. So I have many questions about in my mind. I don't have the answers, but I know that we can borrow from a lot of lessons from HIV/AIDS, how we fought it. Thank you.
Thank you very much, John. Yes, that history is being written. I am penning it myself because I was right there since 1985. So let me now turn over to my brother, Mohammed. Your take, please.
Thank you, Sheila. And thank you, Dean Williams and Harvard, actually, for bringing together such an amazing group of leaders, from Ngozi to my brother John, to Sheila, yourself, Dean Williams, Stephanie, and also those who are listening to us in this webinar. Very little to add, I think, after all this conversation. We're in the midst of the global rollout of the COVID-19 vaccination, which will be the largest public health initiative that has ever been undertaken in its scale, in the speed with which it's going on, and the specificities, especially in low and middle income countries. And it is testing global solidarity and also testing national systems and capabilities. Ngozi talked about the huge divide that we are seeing, which is quite unfortunate and will live with the consequences of the world that we have, because it has casted a mirror on the state of the world in terms of the significant inequalities that exist in our world. But we have to find ways to fix it. In November 2020, for instance, anticipating the availability of safe and effective vaccines for COVID-19, the World Bank, together with WHO, UNICEF, Global Fund, and Gavi, we rolled out an assessment of readiness in more than 128 countries, which are low and middle income countries. And key insights from those initial assessments that we made presented a very high level snapshot of how countries were ready to deploy the COVID-19 vaccines. Because as my brother John mentioned, vaccines plus vaccination, I think, equal to, I believe, lives saved and economies. So to vaccinate, countries also have to be ready. The initial readiness assessments that we conducted showed that while 85% of countries at that time had national vaccination plans, only 30% of them had developed the processes to train the large amount of health workers that they needed for the campaign to immunize their population when the vaccines become available. So they have to get the vaccines first, but they also have to vaccinate the populations. But many of them did not have really good plans for the large amount of training that was needed. And only 27% of them had created the social mobilization and public engagement strategies to encourage people to be vaccinated and to deal with the misinformation. So in this context, nurses are among the most critical piece of the puzzle, alongside midwives and other frontline health workers, especially in the context of multidisciplinary collaborative care approaches that are necessary to deal with the present crisis and to rebuild towards more resilient health systems. Nurses provide a strong and trusted foundation for care, tackling barriers to care that disproportionately affect vulnerable constituencies, the poorest communities. Engaging directly in their communities, nurses and midwives can deliver health education and promotion, can offer nutritional coaching, supplementation, identify subclinical illnesses, and help sustain adherence to public health measures or treatment for diseases. And John mentioned the role that nurses played, for instance, in HIV/AIDS treatment in Africa. In addition, nurses and midwives are essential to the multidisciplinary teams that and offer the benefits for public health preparedness, for responding to outbreaks, whether it's small outbreaks, whether cholera outbreaks, meningitis outbreaks, or in the context of COVID-19 and the immunization that is necessary, and provide resilience that health systems will need in terms of dealing with such emergencies. They can contribute in terms of data collection, in surveillance, and other public health functions. Syndromic surveillance coordinated with national public health authorities can also help identify and contain outbreaks before they spread. Relationships of trust between nurses and midwives and other frontline health workers and their communities facilitates important trust, the communication and behavioral change that is necessary during emergencies. We saw that in Ebola in Liberia, we saw that in DRC, and we're also going to see that in the context of COVID-19. So despite the African continent's resource constraints, I have to applaud the leadership of John Nkosazana and the Africa CDC in terms of the continental approach that it has taken, but also in terms of the flagship innovation, the regional integrated surveillance and laboratory network that you've put together that is helping harness existing public health assets in this time of crisis. And that is why the World Bank financed Africa CDC project is supporting the rollout of the RIS-led network across 3 regions, West Africa, East Africa, and South Africa. It will also finance public health training at different levels, the establishment of partnership agreements with health education institutions to support the development and implementation of public health training programs, and provide technical assistance for establishing and operationalizing an Africa CDC fellowship program to effectively lead public health programs, systems, and networks at national and regional levels. I think, John, you have a lot to be proud of in terms of the accomplishment of the Africa CDC. And we at the World Bank are very pleased to have been able to support you and will continue to do so. World Bank is also supporting the Africa Centers of Excellence for Development Impact, which is a project that we have, a regional higher education project, which has also applied research component, supporting 53 centers across the continent and providing education, training, and applied research in priority areas. This includes 2 centers of excellence in my home country, Nigeria, that focus on nursing education, notably the Africa Center of Excellence for Population Health and Policy at Bayero University in Kano, and the Africa Center of Excellence for Public Health and Toxicological Research. And in the case of Bayero University, Dr. Hadiza Gladenchi, a professor of obstetrics and gynecology, is leading that effort. She leads the center's programs, which include a master's program in nursing administration, master's in public health nursing and policy. So essentially, leadership is key, and cultivating the next generation of nursing leaders and midwifery leaders and healthcare leaders overall will be critical for Africa to transform itself and deal with the present and future challenges, and for the world to roll out vaccines successfully, even when they become available, and to do it equitably between countries and within countries. Over time, nurses and frontline health workers are crucial. They need to be mobilized, trained, protected, and enabled to deliver. So thank you very much again, Dlamini Williams, for really this fantastic initiative, and we're very happy to support it alongside John and other colleagues that are supporting this, including the Budget Trust that has financed it. So thank you, and over to you, Sheila.
Thank you very much, Mohammed. Now over to you, Shirley. The floor is yours. Thank you.
Thank you, Sheila. As Sheila has said, I'm the CEO of the Burdett Trust for Nursing, and we are proud to be a partner and funder of the Harvard Global Nursing Leadership Programme. And I would like to welcome all of you joining us online for this programme's first virtual workshop. What a powerful speech we just heard from Dr. Ngozi, Director General of the World Trade Organization. Thank you, Dr. Ngozi, on behalf of the Burdett Trust for Nursing, for your leadership and advocacy for nursing and nursing leadership worldwide. Dr. Ngozi's keynote speech was spot on. We need to be more equitable in the distribution of the COVID-19 vaccines now and in the time of pandemics. And she gave us multiple recommendations on how to ensure and strengthen nursing and nursing leaders' roles in vaccination campaigns. As she recommended, we need to expand the scope of practice of nurses to lead in vaccination programs and in public health and primary healthcare systems in general. Without nursing and nurses leaders, we will not conquer the COVID-19 pandemic. The time remains now for all of us to invest in nursing education, jobs and leadership. For those of you who don't know, the Burdett Trust for Nursing was established nearly 20 years ago to make charitable grants to support nursing's contribution to healthcare. Currently, we fund 3 areas: building nursing research capacity and capabilities, supporting nurses' professional development, and supporting nurse-led initiatives that improve care at the local level. The Burdett Trust was also involved in the Nursing Now campaign in collaboration with the WHO and the ICN. Nursing Now aims to improve health globally by raising the profile and status of nurses worldwide. Our goal is to influence policymakers and support nurses to lead, learn, and build a global movement. We've worked with partners around the world to advocate for more nurses in leadership positions, supporting better education and training, research, and evidence-based practice. Our mission and vision dovetail perfectly with those of the Harvard Global Nursing Leadership Programme to put nurses at the forefront of care through an understanding and field experience in public health and population health management. You could say, why do we need a global campaign for nursing and a global nursing leadership programme? Simply put, around the world, the need for nurses, and especially nurse leaders, has never been greater. Many countries face huge challenges providing healthcare to their people. These include scarce resources, the rising burden of chronic disease, and the impact of climate change and migration. But right now, these countries are not getting the most out of their nursing workforce. Nurses are often undervalued and unable to work to their full potential. So it's more critical than ever that we find ways to enable nurses to make an even bigger contribution. The Harvard Global Nursing Leadership Programme is starting in Africa to ensure we develop innovative ways to manage the health of populations, strengthen health systems, and ensure regulatory excellence. We need to focus on primary health care and public health and increase our focus on prevention using technology as a tool. These are all areas where nurses can play a leading role. However, maximising nurses' contributions will require that they are properly deployed, valued, and included in policy and decision-making. Nursing Now has supported nurses as leaders in both policy and practice. It is not enough to elevate nurses to positions of responsibility. They also need to be given the support and training required to take on these roles successfully. This is precisely what the Harvard Global Nursing Leadership Programme will do. Today's workshop will help us all learn more about how we can empower nurses to lift the health of populations in one key area: vaccinations. We expect some robust discussions on the role of nurses and how they can be part of the vaccine programs and how we can expand and amplify nursing's contribution around the world. Thank you.
Great, thank you very much. We did it in time.
Yes.
So
yes.
Sheila, great time. Now,
back on
are there some questions?
Yes. So Sheila, you might be able to see this, but we have Professor Adamu, Dean of Faculty of Health Sciences, National Open University of Nigeria. Her question is, there is the need for nurses and other health workers to embark on health education and mobilization campaigns in Africa for people to accept the vaccine. Here in Nigeria, even though there is vaccine, the turnout for people to be vaccinated is very low. So Sheila, I turn this question to you because I think it's a real life example, and perhaps you can take it from here.
But I think it's the truth. It's not really a question. She is stating what is happening, that yes, nurses should be right there with communities to educate, to get rid of the misinformation and really encourage people to go forth and get vaccinated. So that's really the role that nurses should be able to do. So I think with that, we are about to end this because we have another session. So let me finish by simply saying that nurses have shown themselves to be a very formidable and compassionate workforce that can care for humanity in all crises and in all healthcare settings. And during this pandemic, the spotlight of the world really shone on it. And as Shirley has also said, nurses need to be empowered. They need to be in those leadership and decision-making roles, if at all we are able to move. So we must invest in capacity building and expand the scope of nursing and ensure that nurses are educated and skilled to advocate for. Advocacy is also important, to advocate for and to lead the vaccine rollout at national, at regional, and at continental level in our continent. And indeed, without investment in education, we would not be able to succeed. So we are actually grateful for the Harvard Global Nursing Leadership Program to develop policies, and also for partners such as the Bedes Trust for Nursing to be able to invest in this particular adventure. So please take just 5 minutes break so that we can come back for the next session, which is now talking about the nitty-gritty, how we go about it. So let me thank everybody Let me thank you, Stephanie, for being the right-hand man and really for the great work. So I want to thank all our panelists. Thank you very much.
Well, welcome back, everyone. I hope that 5-minute break was sufficient to allow you a little bit of opportunity to refresh and recharge, take a few deep breaths. I'm really glad that we are recording both of these sessions as well as our opening keynote. So for those of you who joined a little bit late, not to fret, there is a recording of the entire program. And so you would be able, if you missed Dr. Ngozi's opening keynote, will shortly, as soon as we can upload the video, make it available for those of you. So again, good morning, good afternoon, good evening to all who have joined us for the Harvard Global Nursing Leadership Program workshop. This, as my good friend Sheila Toulouse said, is time for us to get down to the nitty-gritty to talk about rolling up our sleeves and getting to work on discussing our framing of the curriculum that we are developing for this Harvard Global Nursing Leadership Program. Today's workshop will focus on 3 modules that we will be building out together collaboratively with input from the learners we expect to serve. And so the 3 modules that we're going to be talking about will be population health management, health system strengthening, and regulatory sciences and regulation. We are starting with these 3, but there will be many more. And I'll just briefly walk you through a high-level overview of the arc of how we will be developing the curriculum for this program. And again, it will be a development process that seeks and integrates the input of the learners we expect to serve. So the program is really built off of the exquisite flagship programs that have come before us. We are developing the framing of this program with flagship programs that exist at Harvard and at the World Bank. For example, the very successful Harvard Ministerial Leadership Program is one source of inspiration for developing the program. The 20-plus year flagship program supported by the World Bank on health system strengthening is another source of inspiration for developing the program. And also other leadership training programs that exist across the Harvard landscape and other universities and other organizations will have inspired how we thoroughly, carefully review the landscape, identify the best in class for training and didactic teaching so that we can build together a robust, relevant, and relatable curriculum for nursing leaders. The program will be formed in 2 stages. It's a 2-tiered competency-based plan. The first tier that we will launch immediately is the certificate program. It's a fellowship program, a 24-month duration, and the emphasis is on building skills, both didactically through classroom teaching, but also experiential learning and a capstone project. The second tier of the program will be for those nursing leaders who desire to secure a master's in public health degree to work towards that in filling out a 45 credit requirement for securing a master's in public health, a practice degree. A high-level overview of what we intend the program's content to include and how a successful completion of the program will facilitate nursing leadership roles in population settings as well as clinical settings and in leadership positions. Participants completing the program should be able to engage in population-based public health solution, including bringing population health care management strategies and approaches out into the field. In the healthcare delivery system, participants will have the skills necessary for focusing on systems improvements, in working in the context of medical and healthcare groups, and in working with community health workers and other allied interprofessionals involved in healthcare and health management in most effective ways. From an administrative standpoint, the training should be positioning nursing leaders to optimize their organizations in ways that would bring forward skills in financial management, management of technology, bringing data and data analytics and decision science techniques to their workspace, and also strategic communication and evaluating market performance and partnership skills. So the program will have content that will allow capacity building in both soft skills and harder skill areas across the spectrum. So in summary, the curriculum will include those characteristics that are listed here on the slide. Today, we will be focusing on the curriculum build out for health system strengthening, for population health management, and for regulatory sciences. Other program content for the curriculum are listed here, and they will be built out subsequent to our first 3 areas of module development. Overall, our goal is to equip nurses with leadership skills in these 6 domains: emergency, preparedness and management, human-centered design for health and wellness, health financing, strategic communications, so fundamental to everything we do in public health law, policy and regulations, and health system strengthening. So this is a graphic that shows the comprehensive approach of the content that we expect to provide and support and enable nursing leadership in the global public health enterprise. This slide is meant to illustrate the institutions and the partners and the capacity that's coming forward in order to build collectively, horizontally from the grassroots, the curriculum. And we are grateful for all of these institutions and the leaders of these institutions and their staff and faculty for engaging in designing an authentic and relevant, important program that will fit the need of capacity building for nurse midwife leaders. I'm rushing here because I really want us to move down into the work that we will be doing this morning. We will have our population health management program curriculum design brought forward by Dr. Stephanie Ferguson. Our health system strengthening will be brought forward for deeper dive by Dr. John and Dr. Mohammed Pateh. And then our regulatory sciences module, that conversation will be led by Dr. David Benton, Chief Executive Officer of the National Council for State Board of Nursing. So Stephanie, with that high level overview, I'd like to turn over to you to do that deeper dive in the population health management module. Over to you.
Okay, thank you. It's great to talk to you today about our thinking about the course that we are calling Population Health Management. This course will be designed to examine and develop strategies to improve health within and across populations. This slide gives you a snapshot of the course objectives, but I just want to talk a little bit more about each one so you can get a sense of where we're coming from with this program, and particularly this population health management course. So when we look at identify principles of population health management, we really want to identify and determinants of health, if you will, of population health that impact health outcomes in a community and apply the essentials of public health practice to design innovative and low-cost interventions. Moving forward with our course objective entitled Lead the Formation and Management of Contemporary Healthcare Systems, we want to do this and design the course so that we can do consistently and rely upon on a regular basis the ability to work with diverse stakeholders in the organization and delivery of community-based models of care. We've talked a lot today about communicating effectively, so we are very much interested in working with you to develop the tools, the necessary mechanisms so that you can communicate effectively to constituencies, both within and outside of the health system. articulating frameworks for collecting, analyzing, and using data to inform decisions and facilitate care coordination and improve health outcomes of targeted populations within and outside the health system fit the types of courses and the types of lectures and the case management protocols and systems that we are going to use with an action learning framework so that you can really apply and collect and analyze data to use that to drive decisions. The last one that we wanted to focus on just briefly with you is to develop new ways of collaboration to support not only work at the national level to meet the national goals, but also the district and local public health agencies. So some of the course topics, when we think about patterns of health determinants, we really want to identify determinants of population health that impact health outcomes in a community and apply the essentials of public health practice, once again, to design low-cost and innovative interventions. Decision science for public health nursing is critical. We have to determine the science that we are evaluating using the various frameworks so we can drive decisions that make a difference for all the populations that we want to work with. So one of the things I gave you as a reference examples was how to manage populations, for example, with diabetes and how to put that in evidence into action. And so those two examples give you an example of how to do it, but it also gives you an example of how to take the evidence that you collected and then put that in a policy brief so you can work with your national level key stakeholders to really determine what is needed going forward. So it's very key for us to think about the policies, the interventions that we need to do in the public health outcomes. And that is what makes this course special for nurses and midwives at national levels so that we can really help you get the tools you need to add to your toolkit so we can focus on population health management. So with that, think about what I just said. And then if you have any questions, I'm asking all of you to put your questions in the Q&A so that we all can answer as much as we can for you today. And so I'm going to turn it over to Mohammed and John. And the next slide, health system strengthened.
Thank you, Stephanie. I think John and I will dive a bit deeper on this. And as has been laid out, the course will be designed to strengthen the role of nursing and midwifery leaders in public health and primary healthcare systems to achieve better health outcomes. And as you can see, the objectives would include reviewing public health and PHC systems principles for better health outcomes and progress towards the SDGs, universal health coverage and global health security agenda, bringing the two together, basically, because we've seen how that is, in fact, going to be necessary as we go forward, and integrating the latest technological and biomedical innovations in the delivery of public health and primary health care, and also to apply advanced techniques in finance and decision science and in designing and sustaining health systems, to build the leadership capacity of the participants to effectively drive organizational innovation through distributed health systems. So in the face of complexity, navigating the complexities in health system governance, in financing and delivery, taking whole of government approach, whether it's in intergovernmental fiscal relations, civil service reforms, or finance of health, taking a multidisciplinary, multi-stakeholder view to finding solutions that fit within particular contexts. Those skills will be necessary and will require participants as leaders to negotiate and build alliances and to apply the discipline of execution in terms of moving forward on this. Maybe, John, do you want to take us through the course topics?
Indeed. Course topics will include public health and primary healthcare systems, the latest innovations in service delivery, finance, essential medicines and technologies. Secondly, health workforce strategies for nursing and midwifery in public health and primary healthcare systems. And lastly, leadership and governance, including strategic policy frameworks, oversight, regulations, and strategies in community engagement and development.
Thank you.
Thank you. Good morning, good afternoon, good evening, everyone. I want to focus on the issue of regulation and the centrality of that in terms of moving forward with a fit-for-purpose health delivery system. We know from the session that we had before the break that the issues of scope of practice, the roles that nurses play, the education needed is very central to delivering accessible quality health care. And therefore regulation will play an important part in terms of supporting access and indeed modernising the health system. Dean Williams highlighted the importance of population health. And if you ignore the entire population and simply focus on individuals, we will not be in a position to really move forward. So as we think about regulatory reform, we've got to think about a regulatory model that is fit for today's complex digital society. Our existing model was designed for the industrial era, and therefore it needs significant modernization. Prior to, in the first session, John reminded us that Africa is a relatively young continent. But I want to remind everyone that Africa is the cradle of humanity, and therefore great things come out of Africa. And the work that we can do together in terms of reforming regulation will be important, not just for our African brothers and sisters, but for the way that the economies move forward into the future. So working together will be a centrally important role in terms of this. So it has to be focused on your reality. It has to analyze the strengths and weaknesses of regulatory models that we have, but also what we want for the future. So embedding that in terms of the policy priorities of countries and of regions will be important so that we collaborate together to design a model that is proportionate to the level of risk and facilitates the delivery of accessible services, not just in our large cities, but in rural and isolated communities as well. We need to sustain populations across the total landscape. We will need to engage stakeholders in that process, a wide range of stakeholders. And one of the questions or one of the comments that we received earlier in terms of how do we influence our colleagues in communities to accept the vaccine is an example of the need for us to build coalitions as we move forward in terms of regulatory reform. So working with finance ministers, working with other members of the cabinet will be equally important as working with health and communities. We need to design legislation that is actually agile, that can respond to these crises, and using the relationships that will be with the technical individuals within parliaments and governments, the legislative draftspersons, to enable us to have that flexibility to respond immediately to the crises we face. Sheila, in her presentation earlier, made reference to the work that she had done as health minister in relation to HIV/AIDS. And that was really about out-of-the-box thinking. It was about thinking about how to leverage solutions in a way and to support them using regulations to enable high quality care to be delivered in very different manners. We need to initiate and we need to facilitate the dialogue, and we need to build advocates for regulatory change across jurisdictions. Our ministers talk to each other, and therefore it is important that we work with each other to make sure that there is resonance of action across nation states. To do this, we will work together. We will apply the emerging regulatory science. We've already identified 25 major trends in terms of regulatory reform globally. That literature was drawn from around the world, from all continents. And therefore, we are using that as part of the benchmark to drive forward our understanding of what will work for you in your nation. We need to design those systems in a way that actually supports access and delivers health that is safe, effective, and accessible to all. And we need to use data science. One of the lessons that we have learned in terms of our regulatory role during the pandemic is the richness of data that we can provide to decision makers. And therefore, as nurse leaders, we need to recognize its value. We need to curate it in a way that is understandable by all, but it needs to be available in real time, not historic information. So as part of the regulatory reform agenda, we will be looking at how we not only change legislation, but how we actually provide information in a way that supports government in sound and effective evidence-based decision-making that will enable the public health agenda to be addressed and health systems to be strengthened, not just for today, but for tomorrow. That is the task that we as nurse leaders have for all of our population. Thank you.
Thank you, David. This is our time for question and answers, and I have looked at our questions and answers, and what I am seeing is affirmation that Aisha Holloway, who's the Dean of the University of Edinburgh, said she liked the two-tiered approach and that it is a fellowship program. It's an excellent model with option for master's, exit for those who wish to do so. And also, I just want to say that these three presentations are all interconnected. So before I talk a bit more about population health management and just ask some questions and ask some feedback from all of us, I want to just briefly turn it back over to Dean Williams, because she is also able to connect the dots for us and share more about how the three courses are connected. Dean Williams.
Thank you, Stephanie. I just wanted to interject one thing in terms of reflecting on what we've heard from each of the three module teams. Is I'm inspired and remembering Dean Julio Frank, the prior dean of the Harvard Chan School, my previous boss, and also now currently the president of the University of Miami. Dr. Julio Frank would talk about creating T-shaped intellectuals. And by that, he meant it was his framework for how to prepare interprofessional scholars to engage in understanding a broad, the top of the T, a broad cross-section of skills and content knowledge that would complement their primary, the straight, up and down part of the T, their primary disciplinary training. And I'm inspired by that framing for how to prepare, promote, and position nursing leadership. Nurses come with this incredibly strong, deep knowledge in clinical nursing science, life sciences, and healthcare. And what we aim to do is to strengthen, broaden, expand capacity for leading and managing within the clinical space, but also in the spaces where health and wellness really are influenced. And that is in the environment where the social determinants of health really play out. And in doing that, in building communication skills, analytic skills, understanding financing, and really developing that strong foundation that would enable interprofessional engagement in solving multidisciplinary problems across multiple sectors is really the driving force. And I just wanted to bring that back because you can then see how these three modules interconnect and position and prepare an additive value to the deep disciplinary training that nursing leaders already bring to the table.
Very good. We have another question for the panel from Dr. Holloway from the University of Edinburgh. She is talking to us about the concept of the importance of communication and how it is often seen as a soft skill as opposed to the technical skills that we need, particularly if we are developing and influencing and framing the agenda to gain global priority. Can we all say more about this? And can we also talk about what we can see with greater traction in the use of alternative techniques as we talk about the development of communication skills in the context of public health and primary health care? I turn it over to the panel. Who would like to go first?
Stephanie, perhaps I can kick this off. I think one of the important things we've got to recognize is that we need to reach beyond our nursing community in terms of some of the communication. So the point that Dean Williams just made around multidisciplinarity is critically important, but we also need to reach beyond the health family in terms of solving some of these problems as well. Some of the work that I've done previously on the use of social network analysis as a way of identifying key pathways to communicate your message is really important as we move forward with this. It's not necessarily the most powerful message when it's delivered by the individual themselves. It's when that message is echoed by others and they are in alignment with you in that process, that they will often be your strongest advocates, will have the ear of the president of the country or the cabinet, and actually having the finance minister bring forward the line of argument is often a better strategy than actually having the chief nurse make the argument, because giving an understanding of what's in it for them rather than what's in it for you is a much more successful strategy in moving forward the goals that we seek to achieve together.
Well, let me just add to that. I think navigating the complexity of health systems as a leader requires the breadth, like Dean Williams mentioned, but also what it means in reality is that leaders would then have to have a repertoire of skills in various areas that they will bring to bear. And communication, while it might sound soft, is probably one of the most important skills that a good leader will need to have in terms of being able to connect based on the context, based on the audience, because at the same time, sometimes the leader would have to inspire, but also sometimes support, sometimes to negotiate, to broker consensus, or to decide. And that and other skills that are necessary, but not part of a deep clinical expertise, not the clinical scientific expertise, finance, budgeting, the more sort of out of the field. But those repertoire of skills are necessary, not in the same level of depth, but the leader will need to understand so as to appreciate even the other stakeholders. How does the finance minister think? How to convince the planning minister or the director of planning? How to engage others, the unions, how to negotiate with other providers in the health context. And so I think this is a rounding up, so to speak, for those that are at that level that can then step in to play important leadership role for them to be followed. Because it's not enough only to be the leader, but for people to actually follow. So those skills are very important. And I believe that the combination that has been laid out in these 3 modules will come together in terms of how the courses will be delivered and the tools that will be used so that the participants will then acquire those skills, those competencies, and take them into their work and test them out as they grow in their leadership journey.
Very good. We have another question, which is a very good question that I think Dean Williams and all of us can address. But one of our dear colleagues, Paula Malone-Nuzzo, who is in the Boston region, she's one of the deans of one of the esteemed universities in Boston. And she is wondering where the skills of leadership are included in the curriculum, using the skills that will be taught in these courses. So I'm going to take a stab at this, and then I'm also going to turn this over to Dean Williams. But as we see this as a leadership program, we see the skills for leadership across all of the courses, because with each course, we will focus on the leadership skills, the knowledge, the skills, the ability that you need as an executive level leader to be able to be successful, for example, in population health management, to be the leader in health system strengthening, to be the leader in regulatory sciences. So I hope that answers your question, but also Dean Williams, anything you'd like to offer?
Yeah, thank you, Stephanie. And thank you, Dean Paula. I'm delighted that you've joined us, and I'm also delighted that you're a member of our advisory council. It's very important that that question that you've asked. You know, as I reflect on my 30-something years in academic public health, I'm often struck by how traditionally siloed we've been in our the way we've structured our educational materials, that, you know, the epidemiology would learn epidemiology, and the health policy and management, you know, candidates would learn health policy and management. And maybe there's one common course that, you know, these two areas, these students in these areas would have. It's my hope that with this intentionality that we're bringing to the design of our courses, that we will break down those traditional silos and weave across the curriculum all of these necessary skills through teaching, both using case study methods and also building in experiential and capstone learning opportunities, so that leadership training is infused, communications training is infused, financial analysis and decision analytic tools are infused throughout the entire curriculum. So in other words, I think it's a brilliant question, and I think we're all collectively working to reimagine, redesign the way we train leaders by infusing leadership skills and techniques throughout the entire curriculum.
Very good. Other comments from the panelists?
I think David has something to offer.
Yeah, I think one of the things is that the whole concept here is it's an action learning based approach, and therefore getting individuals to contribute what are the real world issues that they are dealing with, and then in a safe space work through how you might tackle that, and to ask your peers to put on different hats. So you know, somebody might say to Stephanie, Stephanie, I want you to think about this from the perspective of the health minister, the point that Mohammed just made. How does a health minister think? What are the issues are? Because the more we actually understand the drivers, the motivators of others, the better equipped we are to lead in that space. And I think it was John that made the point about the fact that sometimes we have to lead, sometimes we have to support. And I think knowing when to do that, because if we're thinking about growing the next generation, some of us have got to actually back out and create the space for youth to come forward and actually give new and wonderful creative ideas.
Very good.
Maybe let me just share a little bit of perspective there. I started this during the first session. We talked about, I joked about Ngozi working with Ngozi and Donna Kaburuka and others when at the start of this pandemic. I think that is what David is alluding to here, and Dean Williams, where at the level of the African Union, they said to me, John, you are the public health expert, tell us how we need to manage this pandemic. So we wrote the continental strategy. The head of states endorsed it. We shared with them a vaccine strategy that we needed to vaccinate 60% of our population. The same group, and I needed to convince the Strive Mercy world, the Vera Songwe, the Ngozis, that why I was asking for 60%. But once they got that, it became their responsibility to go find me the money, to go out there, mobilize the resources to support me to get that target. So when we meet every evening or every week to discuss that, I mean, my job was to keep telling them that, look, this is where the good vaccines are, go get it, go find the money. They'll mobilize ministers of finance, ministers, other ministers to come and rally. So that is the power of what David is saying and what Dean Williams said about the T framework, which I think is an extremely powerful and very simple, yet very simple way of framing the need to balance depth and breadth and to address public health goals. I said, well, I'm a public health expert for 30 years. I mean, this is what we have. We have to solve the problem. And we would never have made any progress on the continent. We knew that we needed diagnostics, but the Master Iweala and others, once we convinced them, they know how to set up a platform and they know how to reach President Ramaphosa's office to talk to the President of China to put the diagnostics on the platform. So it is really, really what we are discussing here. I just wanted to bring a very personal example on how leadership in play and how you bring the different non-health actors to the table. And as David said, the question is always, what is it in for them, not for you? I think if I had framed it like this is this is probably heard in action, nobody will leave it up to me. So I think it's really a powerful way of summarizing this. I just thought I should share that personal perspective.
Very good. We also have a question. This is for John and Michelle and Mohammed too. Wanting to know, is the Francophone region on board? And so I just want to turn that over to John and Michelle. Thoughts on this?
Well, I think for because we are the African Union, all parts of the continent are engaged. I mean, and if we start the first cohort, if it's biased towards a certain linguistic line, then we are sure that it will balance up as we move forward with the subsequent cohorts. So, but again, the principle and the conception is that, this is the whole of Africa approach.
I don't have much to add. I just want to say that my goal and the reason why partnering with John and the Africa CDC and the African Union was so important to me is that this is truly our best way to democratize the assets that we are building and making it as widely available. And I couldn't have selected a better anchor partner in John and the Africa CDC because they have, from inception, illustrated and demonstrated a commitment to a pan-continental, an all-Africa approach. And I think that's an important way to launch this. There are, however, going to be some technical challenges which we will overcome with resources. And that is to make sure that we are making our educational material as available across all of the major languages as possible. And right now, that is our initial barrier, is to make sure we build the curriculum, but then also democratize it by having the necessary rigorous and stellar skills and platforms for making it available across multiple languages. Back to you, Stephanie.
Okay, we also have a question, and this will be for all of you, but perhaps maybe John and Mohammed can think of this. What work will be done with others in the field, physicians, scientists, patients, to appreciate and support the goal of increasing nursing leadership? This may be beyond the curriculum, but wondering if there are strategies for community buy-in tied to developing the certificate and degree program. So I turn that over to John and Mohammed and David. John?
Yeah, I think the same conversation or strategy that David and William talked about here, about engaging others. I mean, the whole thing, the centrality of what we are trying to do in a global nursing leadership program is bring others together using their own influence to solve a problem. I mean, I think that is it. I mean, it's just, so it means that you have to see it as different factions. I mean, everybody, the ministers is one faction, the different, the non-nurse, the doctors that you work with is a different faction, and other technicians. Really, your responsibility to consider yourself as being at the center of all of this and pulling everybody together so that you can solve the problem at stake. I think that's the way, you rally all the different factions to enable you to move an agenda forward.
My sense is that leadership is difficult to be imposed. When it's there and you see it, you know it. And my interpretation of the vision that Williams had, and with all of you, is to create a cohort of leaders that demonstrate that leadership in reality and enabling them through the curriculum, that they would then be in a position to exercise those leadership qualities. And that when nurse leaders emerge who are equipped with the tools, the scientific tools, the understanding, the expertise, but also the boundaries of what they know and what others know, they would be able to demonstrate, let's say, the bringing together people to solve the problems that John was referring to. So the solutions to health systems, the imagination, the difficulties that ministers or directors or ministers of finance would be having would be seen. And that by itself is how people will then follow those leaders, and that will then be the manifestation of the reality of this vision of creating a cohort of leaders. So it's one that I think will be earned, and the tools that they would learn from this program will equip them to earn that leadership, to communicate better, to understand these other fields, the T part in addition to the depth of what they understand. So that's how I see this unfolding.
Very good.
So
Dave?
I think one of the things I would say is that we've got to recognize that we're not starting with a blank sheet. Many of the nursing leaders in the continent have got extensive networks. It's how we get an overarching picture of those networks and how we can utilize those in a way that is in concert. It's like having an orchestra. It's actually about making sure that everyone plays their part at a point in time, which will have the biggest impact. So actually understanding some of these issues, the existing networks, to use that to focus some of the work that we want to do will be important. It'll also be about identifying where some of the gaps are and having strategies, agreed strategies, to actually build out some of those spaces as well, so that we do have coverage in those areas that perhaps we're not as strong on. So, using the shared experience of all of the nurse leaders is a great starting point, but having that critical conversation about where we have strength, where we have weakness, what are we going to do about it will be the critical issue for all of us.
If I love those responses, and David is spot on. There's another dimension that I'd like to add, and I equate the part of the question and the source of this question to a question that we're all grappling with now as we're in the middle of a pandemic. When nurses and nursing leaders do their job well, nothing bad happens, only good thing happens. When public health is at its best, nothing bad happens. We don't even see it. And one of the things that we have to do for both public health and for nursing, the nursing profession and nursing leadership in particular, is to raise awareness outside of our professional fields, but even in the general population. Because we need all stakeholders, not just the professional organizations and the professions, to appreciate just how important nursing, leadership, nurses, and public health are. We have routinely undervalued, underappreciated, invested in these real pillars of civil society's support and insurance for enabling all of our thriving. So part of my agenda, and I'll be very explicit, is to make sure we no longer undervalue, underappreciate, not see the importance of investing and supporting and enabling nursing leadership, and by association, population health and global health security.
Very good. I just wanted to share everything that you all have said. We're getting feedback from those on the line that just say the points that are being made are crucial, engaging, and general public is fundamental. So I don't have any other questions that the audience has asked, but I just want to, before we close this session out, anything, David, you would like to close with, and then we'll go to Mohammed, then John, then Michelle.
Yeah, I just wanted to pick up on, I think Aisha Holloway made a comment about the importance of political science as part of this. And I think there was a message also from Director General as well around the importance of actually not seeing health in isolation, but actually a healthy nation is a prosperous nation. And both of those are actually underpinned by sound education as well. A lot of the work that the World Bank has done, particularly in relation to how you lift people out of poverty, is through education. Nursing being a predominantly female profession, it's a wonderful way of actually doing that. But we've got to design our education systems in a way that enable people to bridge from one level to another without having to go back to the beginning as well. So I think the centrality of having a really open mind to how we relate to a wide range of disciplines, not just the usual suspects, not just public health and physicians and pharmacists and nurses, but economists, political scientists, business administration, all of these areas. I think that's part of what Harvard brings, is that broader view of how we tackle some of these major health problems that everyone has a role to play in solving.
Thank you.
Powerful.
I think if I can just, I think David said it all. I think very little to add. I think this is going beyond narrow expertise. It's in fact pushing the boundaries beyond expertise to have the participants have repertoire of skills that they can bring to bear in exercising leadership wherever they find themselves to create the change that is necessary for the world to be a better place, whether in government, whether in the private sector, whether in consulting, whether in civil society or in their communities. So I think this is how transformation occurs. And I really encourage all of us to apply our minds and all our efforts to make sure that it's successful. So thank you.
John, last comments with this section.
Absolutely. I think it's all about effecting a change and managing the change. I think that is well said by Mohammed and David, and very little to add to it. But very importantly, you have to enjoy it. I mean, you absolutely have to enjoy it, and the way you enjoy it is by believing in the course of action that you are leading there. So if you ask me to lead something that I don't enjoy it, I'm not passionate about it, you don't see it. I mean, Mohammed said it all, when leadership is there, you see it, you feel it, you know it's there. So, I mean, so you have to be passionate with what you are called on to lead that change, to manage the change. And usually, of course, it comes with all kinds of challenges, but you have to be courageous. I mean, just 3 things I'll leave you with. That this leadership at any time requires that we have the conviction of doing that. We have the courage, and you are hopeful. If you have the courage, you have the conviction, and you are hopeful, then you exercise effective leadership. Thank you.
Very good. All right. We are going to pivot now to our closing session. So we're going to ask that John and Michelle stay on. Everybody else, you can take your videos down and also mute yourself. But thank you so much for being in this section to discuss the population health management course module, health system strengthening, and regulatory science. So we give you all a hand, all of us. And so now we will go to our thank you slide. And I just want to say thank you to Michelle Williams, and also to Dr. John, and I turn the program over to Michelle and John.
Thanks so much, Stephanie. And let me just, a heartfelt thanks to all of the panelists today, and to all of the team unseen, behind the scenes, who've made this session possible. You know, I have to pick up on John's courage, conviction, and hopeful. You know, these are really inspirational parting words that he's sharing with us. And I just want to take a second and to personally thank John, because these are wonderful aspirations that we should all work for, to be courageous, you know, to have conviction and to be hopeful. But the last 14 months have really been very challenging. And I am also humbled and grateful because as all of the participants, all of the panelists that you have seen and heard from today have had massive challenges and massive leadership responsibilities along the way. And they allowed and afforded me and my team at the Harvard Chan School to continue to move forward in building this nursing leadership program. And especially you, Dr. John, a special thanks, because you were multitasking from that fateful time you were visiting with us a year ago to that lovely dinner that we had where we talked originally about this idea. And you have been a steadfast partner. And I couldn't be more proud and grateful than to have you and your leadership of the Africa CDC as our anchor institutional partner as we imagine to take on this responsibility of enabling and bringing forward the best skills and educational products that we can for global nursing leaders, starting in Africa, but expanding globally to serve nurses everywhere. I also want to take a moment and to thank Dr. Mohammed Ali Pateh, to thank Dr. Sheila Talou, to thank David Benton, and most importantly, Shirley Baines, for having the confidence, the trust in our conviction, in our courage, and in our hopefulness in moving forward, moving ahead in building this program in the midst of a pandemic. I also want to thank Harvey Feinberg, President and CEO of the Gordon and Betty Moore Foundation, for also having the trust and confidence in funding us. Thanks to everyone for participating. And John, I'd like to just turn over to you for some final words of thanks. And then I will just say a few remarks about next steps for all our participants today.
Thank you, Michelle. And it's amazing how this partnership between the Africa CDC and your department, that is the School of Public Health, has grown. And then it's amazing when we discussed this just over a year ago. I thought it was a good idea, and I knew that it was going to take hold, but I was thinking of in the next 3 years or so. I mean, I'm really amazed to see that within 1 year, this has come that far. The Africa CDC is in this because everything that we have discussed today align with Africa's continental agenda, the Agenda 2063. And I would like all the course participants here to take note of that aspiration for the continent, a roadmap for our development. And each time apply yourselves as part of contributing to that continental development and vision, and which is really nicely created out of the wisdom and vision of our head of states. We are in here because this program aligns with Africa CDC's workforce development framework. Clearly, this is one of those courses that is being supported, that we are supporting it. We are also running, as we speak today, a cohort of 20 global health leaders in what we're calling the Kofi Annan Global Health Leadership Program. The first cohort started already, and it was a very competitive process that we were able to select 20 outstanding global health leaders from a pool of 600 applicants. And our friend, colleague, Alex Coutinho is driving that, as well as Dr. Tash, who has also been critical in working with you and Faith in moving this program forward. So the reason I cite those is to make clear that we are not just in this because we like to be partnered. We like to partner with Harvard. We are in this because it means a lot for us. It's contributing to our workforce agenda on the continent, and as a show of demonstration that we ourselves are running a program already. We just started a few weeks ago on global health leadership as a whole. So the whole concept of leadership is embedded within the Africa CDC's DNA. So, and nothing of good these days, or in our world, given the interconnectivity, comes without partnerships. And what we are calling, as part of our new public health order, what we refer to as a new public health order, about trusted partnerships. And this is one of those trusted partnerships, is respectful of our own needs, is listening to the two parties that come to the table to cooperate or collaborate. There's a saying, and end here, that the only reason collaboration exists is because two parties bring something different to the table, and together you can build the whole. So I think that is why collaboration and partnership exists. So we're truly grateful for the manner in which this partnership has evolved, the listening part of it, listening to each other respectfully, and growing it and respecting where each other is coming from. I think it's clearly, maybe it's probably one of those great lessons in leadership that the participants should learn. So thank you for being, we are really honored for being part of this very important discussion and this important program, the nursing leadership program. Thank you.
Thank you, John. Two final comments. A special, sincere thanks to Dean Elmendorf and Dean Bridget Long, my fellow deans at Harvard, who are part of this important multi-school initiative. And then a warm and deep, sincere thanks to my partner and co-director of the Harvard Global Nursing Leadership Program, Dr. Stephanie Ferguson. All of the progress that we have made is because of Dr. Stephanie Ferguson's able leadership and capacity to bring together all of the stakeholders, have them be heard, and have their inputs executed and operationalized in the manner that is reflected here. So a sincere thanks to you, my friend, Dr. Stephanie Ferguson, for being a domain expert, being a partner in public health, and just being an extraordinary person. So thank you, a sincere thanks. To all of you, I want to thank you for your time, your patience, your contributions, and do look out for emails from us. We will be sharing perspective from this session. We will be sharing a link. We will be following up with you because we want to hear from all of you as we continue to design this important curriculum and offer it to the first cohort of learners. So thanks, be well, be safe, and let's get the globe vaccinated. Thank you very much.